So today I will tell you the dangerous side effects of Levopraid tablet. I'm your pharmacist, Dr. Abdur Rafy. I'm doctor of pharmacy. I have a specialty in pharmacy. I'm a drug expert, and you're watching Rafy Healthcare channel. So let's start. Its brand name is Levopraid and its generic active pharmaceutical ingredient is Levosulpiride. It is a 25 mg tablet and its manufacturer is Pacific Pharmaceuticals, which has taken permission from the Revisa. It has taken the license from Revisa Pharmaceutical to manufacture this Levopraid tablet in Pakistan. Okay, now let's discuss its dangerous side effects. But let me tell you about this medicine uses. This medicine is an antipsychotic. Basically, it increases the release of acetylcholine, which is a neurotransmitter. Okay, so that's why it is an antipsychotic. It is used to treat a lot of conditions and a lot of diseases, like it is used to treat depression, indigestion, GERD, and also psychiatric disorders, irritable bowel syndrome, and it is also used to treat anxiety disorders, vertigo, hallucinations, and also schizophrenia. It is also used to treat heartburns also. So basically it is used to treat a number of problems and diseases and disorders. So it's a good medicine. It also increases the movement of intestine and stomach. So it's also a gastrokinetic drug too. So it means it has a lot of uses. Okay, but this medicine also has side effects, and we'll be discussing it, and dangerous side effects too. So I'm taking out its leaflet. So this is the leaflet here. Yes, so I have already tell you about it, that Levopraid brand name Levosulpiride is the generic, which contain Levosulpiride 25 mg. Okay, pharmacological classification, and then we have the indications. Here you can see like GERD, irritable bowel syndrome, dyspeptic syndrome, essential cephalgia, vertigo of a central or peripheral organ. So it is used to treat a number of conditions. Okay, so now let's discuss its side effects. They are saying for prolonged administration, it can cause amenorrhea, which is the absence of menstrual periods. So it's one of the alarming side effect. It also causes gynecomastia, which is a cosmetical problem. It is the men are greatly affected by it because it is a cosmetically problem, because in gynecomastia we have the structure of breast to the man. The men or the males feel very uncomfortable of having a gynecomastia, like they are having a breast on their chest. So it causes it. So that's why galactorrhea, it is the unusual discharge from the breast, which is unusual, not commonly produced. Okay, and also it alters the libido, which is the sexual desire of both males and females. So it can also affect the libido, and basically it is a reversible effect wherever the patient will be using levosulpiride. So when continuously he she will be using, then he can be affected. When he or she will stop, or his or her treatment stops, so he can or she can cover. Okay, so basically why it is caused, because it affects the hypothalamus and pituitary gonadal axis. Okay, that's why it causes gynecomastia, galactorrhea, and like this, and also affected the libido. Okay, it also has other side effects as neuroleptics, so I'll be telling you about that too. So these are the main side effects. You see, these are the most common that it occurs in it. If we talk about here that which are dangerous, so I think gynecomastia is the problem for the males, because they won't they won't like to have breast on their chest. So this is the side effect that most of the males won't like it. Okay, so if we talk about like just like other neuroleptics, they are saying na, so they are So they are saying that just like other neuroleptics, it also has side effects. So the common side effects neuroleptics produce are headache, which is the pain in head, fatigue, and as it increases prolactin level, that's why gynecomastia, galactorrhea. So it also increases prolactin level. It also causes drowsiness. Okay, irregular menstrual periods, that's of course amenorrhea, and it can also cause constipation, abdominal pain and cramps, weight gain, and the patient may also feel unusual tiredness. Increased salivation means increase in saliva, and also excessive sweating. It can also cause arrhythmia, which is the change in heart rate. It can also cause arrhythmia, which is the sudden or the slow or the fast change in the heart rate. Okay, so it also causes abnormal heart rate too. So these are the alarming or the dangerous side effect that it can cause change in heart rate, abnormal heart rate. More if we talk about the dangerous side effects, then we have the allergic reactions, which are very dangerous. If you are allergic to this medicine, you should not use it. And it can also cause hypersensitivity reaction, which are indeed also dangerous. So if you are allergic or you are sensitive to it, you should not use it. Okay, you should use another medicine for it. And if we talk about that, if we overdose it, then what would happen? So you can see here, if you use it in high dose or use it for a prolonged period of time, then you can have, or if you use it in a wrong way, specifically in wrong way, then you will have a lot of side effects. Okay, you can see here in high doses they are saying that it can cause sleep disturbance. The patient may have disturbance in their sleep. It can also cause restlessness, also excessive muscle movements and tremors if you overdose it. Okay, so you should not overdose it, because of course when you will overdose it, its side effects will be increased and their intensities will also be increased. Okay, so these are the side effects, and as you can see, there are some dangerous side effects like gynecomastia, irregular menstrual periods. Irregular menstrual periods, usually women are affected, females are affected, but in gynecomastia, males are affected. And also allergic reactions, which are also very dangerous. Okay, and abnormal heart rate, which is indeed also dangerous, that's arrhythmia. Overall, this medicine side effects are tolerable, and yes, it's a possibility that you don't have these all side effects. Okay, because these side effects were taken from the patients, multiple kind of patients, and they complained about these side effects, then these side effects are written here. Okay, so you may feel all the side effects or you'll feel some of these side effects, as I have mentioned. Okay, so these side effects can occur. Okay, now it depends on patient conditions and the case and the dose he's taking, and for how much and how he or she is taking. So it depends on it too. So these side effects can occur. Okay, so all the side effects I have mentioned, you could have some of these, or even possible that you could have more side effects than these. Okay, so these are the possible side effects that you can have. So these are the side effects it causes. Now the question arises that if this medicine has these side effects, then why we are using it? So answer is very simple, because as I have told you the uses of this medicine, it's a very good and effective medicine, and it is used to treat a number of conditions and diseases. So that's why it's in the market and it's still being used. Okay, the main purpose of telling you the side effects is this, that you may be aware of these side effects and you could prevent those side effects. Okay, always consult your physician and pharmacist before using these kind of medicines. Why? Because they have already designed the regimen, they know the side effects, which medicine cause which side effect. So they already designed the regimen, and they know, they have already given the counter medicines for it, that if these side effects occur, then we'll counteract with it. For example, I give you an example. If metformin is prescribed, it is an anti-diabetic drug. So whenever metformin will be prescribed, physician and pharmacist knows about that metformin cause vitamin B12 deficiency. So they will already give you vitamin B12 with the metformin actually. So you won't have the side effect, or the patient won't have the side effects. So they will think that this medicine doesn't have a side effect, but it had the side effect, but it was counteracted by the medicine given along with the metformin. Okay, so now you understand the theme, and I hope you understand the video. So I hope you found this video informative. Please like it, share it, and subscribe to our channel. And if you have any question regarding this medicine or any kind of medicine, drop in the comment section. I will reply you. And now take care of yourself, and always remember your pharmacist Dr. Abdur Rafy in your prayers. Allah Hafiz, and take care.